The Fitzpatrick scale was developed in 1975 by a Harvard Medical School dermatologist named Thomas Fitzpatrick. Understanding this scale is crucial in providing the best and safest treatment for your clients. The system classifies skin type according to the amount of pigment your skin has and your skin's reaction to sun exposure. This information can help predict the outcome of your treatments and their overall risk of sun damage and skin cancer. There are 6 different skin types in the Fitzpatrick scale based on 3 specific traits. 1. Your genetic disposition. Genetics is one of the many aspects of you, including your eye color, hair color, and skin color. Number 2, the reaction to sun exposure. The way your skin reacts to sun exposure is important when assessing your Fitzpatrick type. What happens when you stay in the sun too long? Do you burn or tan? What degree do you turn brown? And number 3 is your tanning habits. When did you last expose yourself to the sun or tanning beds? Let's dive into understanding the Fitzpatrick skin types. It is possible that you won't meet all of the characteristics of any one type, so you should go with the one that best describes you. Fitzpatrick skin type 1. Very light ivory skin with reddish and pink undertones. This type of skin is highly sensitive, always burns, with painful redness, blistering, followed by peeling and then never tans. Freckles are very common. They tend to have light blonde or red hair and light blue or gray eyes. Their genetics tend to be Scandinavian, Nordic, and Northern European. This type is at the highest risk of photoaging and skin cancers. They should have a regular scheduled appointment each year with their dermatologist for a head-to-toe exam. Fitzpatrick skin type 2. White, fair skin with pink undertones. These individuals are very sun sensitive, usually burns first, then peels and freckles. They rarely tan, but might develop a slight tan. They tend to have naturally blonde hair and blue, gray, or green eyes. Genetics are Caucasians, Northern European, and Celtics. This type is also at the highest risk of photoaging and skin cancers. They should have a regular scheduled appointment each year with their dermatologist for a head-to-toe exam. Fitzpatrick skin type 3. Beige skin with more golden undertones. These clients are moderately sun-sensitive, sometimes burns, followed by peeling but might actually develop a reasonable tan. They tend to have dark blonde to light chestnut brown hair, can have any eye color, and their genetics are usually Caucasian, Southern European, Northern Asian. If you like what you've seen and want more of the same, please hit like and subscribe. In general, Fitzpatrick types 1 through 3 have a low risk for problems like skin discoloration, blotchiness, burns, and scarring. It's ideal for treatments like microdermabrasion, all types of chemical peels including TCAs, laser and light treatments, skin needling, Botox, and fillers. Fitzpatrick skin type 4. Darker beige skin color with golden light brown or olive undertones. These individuals have very little sun sensitivity, tans easily, and rarely freckles or burns. They tend to have dark brown hair and dark brown eyes. Their genetics are usually Mediterranean, Hispanic, some African American. Skin type 4 can be prone to an overactive production of melanin following sun exposure, which can result in the uneven pigmentation of melasma, especially if they are on hormonal therapy such as oral contraceptives or even during pregnancy. Most esthetician treatments can be performed safely without adverse side effects like microdermabrasion, most types of chemical peels, laser and light treatments, and radiofrequency procedures. Skin needling, Botox, and fillers. Consider a tyrosinase inhibitor for a few weeks before you begin treatments to suppress the melanocytes and avoid post-inflammatory hyperpigmentation. Fitzpatrick skin type 5. These clients have darker brown skin tones, rarely freckles or burns, and always tans. Their hair color is dark brown to black with dark brown to black eye color. Their genetics are Eastern Indian, Southern Asian, Middle Eastern, dark Latinos, and African Americans. Fitzpatrick skin type 6. These are black-skinned individuals with black hair and brownish black eye color. Their genetics are typically from Africa or indigenous Australia. Fitzpatrick 5 and 6 are unpredictable with treatments, which can lead to potential problems with post-inflammatory hyperpigmentation or unevening darkening or lightening of the skin. Post-treatment, this type can result in hypopigmentation or a loss of pigmentation in the skin. There is a greater risk of keloid and hypertrophic scarring in Fitzpatrick 5 and 6. Darker skin has a better foundation of collagen, suggesting that fibroblasts are more abundant and active. When creating a treatment plan with your client, include pre-treatment home care to avoid hyper or hypopigmentation. Microdermabrasion and light chemical peels can be very effective treatments for Fitzpatrick 5 and